Okay, I can get started. So welcome everyone. Thank you for joining us to our audiology kind of happy hour. We're going to start today. We'll review kind of what ISHA does for its members and what value it truly does hold. We'll talk about some DEI in audiology specifically. How to be involved and stay connected, and then just a listening section. So to hear from you all, if you have any thoughts or feedback for us, how to make ISHA more accessible. So just kind of time for us all to chit chat at the end. And my name's Kellsie Busho. I'll introduce myself. I am a clinical instructor and audiologist at the University of Iowa, and I am with Stephanie Fleckenstein and Kevin Kock. If you two want to introduce yourselves or no.
Yeah, I'm Stephanie Fleckenstein, and I am also a clinical instructor at the University of Iowa, Department of Communication Sciences and Disorders, and I am the ISHA VP for Audiology.
And my name is Kevin Kock. I am in private practice at Audiology Consultants, serving the Quad Cities area of Iowa and Davenport, and as well as Moline, Illinois, and I'm the treasurer of ISHA. Thanks for being here today.
All right, so we'll start just with a brief review on ISHA's mission. So why ISHA really exists. So it really aims to connect current and future professionals in speech language pathology and audiology via the means of education, advocacy, and really promoting that professional integrity. So it's great to have that mission, and the vision is really to help us all as professionals have that kind of go-to place to come together, share resources, pool resources, as we'll talk about moving forward. So how we work towards that mission. So there's an extensive list, and I'll show you how to find them online on the ISHA website. I actually just discovered this a few weeks ago myself. So for audiologists specifically, they have EDI resources, they have hearing conservation, they have anything you can think of, they have a link to it. So it's really easy to find all in one spot. You can tap into like the collective expertise of others, whether it's our speech language pathologist colleagues. Everyone is listed with their contact information. It also serves as a way, if you are a member and you were conducting research, for example, and wanted to reach out to others, you can access that listserv. And also vice versa, it can help our university students and colleagues, the researchers, if they're doing any data, you'll receive those emails as well and choose if you want to participate. ISHA aims to educate the public about services that we provide, why we're important, whether it's the public and also other professions. We've collaborated with other professions to, again, just share what we are and what we bring to that table. Continuing ed opportunities. So the big one is our annual convention, and we're excited, keeping our fingers crossed that this year it will be in person again in Iowa City, but we're also learning from this COVID era of Zoom and gonna try a hybrid model. So giving access to more of those resources and speakers for individuals that may not be able to come to Iowa City, but also tap into our neighboring states if anyone else is interested. The other big one we just had was Advocacy Day, which we'll learn and talk about a little bit later. But for myself especially, that's been such a big piece of being more an active member of ISHA, is learning about the legislation and how things are passed through. As someone in our group had said, you know, Des Moines, they're the ones that dictate how we can do our jobs, what our license says, but they may not even know what an audiologist is. So especially for audiologists thinking about the over-the-counter hearing aids coming up, how can we really have a seat at that table? And ISHA gives us that collective voice and has those resources for us to reach out. And then also we recognize those in Iowa for what they've contributed to our field. All right, so going back to the list of resources. So if you go to ISHA.org, very easy to find. And then in the upper right-hand corner, you see the big blue circle here, member portal. So if you click on that, and then you log in, and it takes you to kind of just your profile. From there, I have it up here. If you click on like educational resources, for example, then you can scroll down. So for audiologists, all of these here will then take you to that website. So if there was something specific you were looking for, you just wanted to see, hey, you know, what's Iowa Medicaid member services? Where is that resource? Right here. And just takes you all one easy to find spot. See if I can toggle back here. All right, so that's a very brief overview. Let us know at the end if you have any questions on the website, but there's so many great resources available there.
And really quick, I wanted to touch on the ISHA expenditures and what it goes for. A lot of members ask, what do our dues go towards? And so I figured we should be transparent about that. And so, and I apologize, my dog decided to bark off on the side. So if our dues and if our funds were in $1, then 22 cents of that would go to communications and public information, things like the ISHA connection, our website and social media channels, retention and recruitment. 33 of those cents would go to government relations. So things like our public policy lobbyists that really help us do our grassroots advocacy up in Des Moines. And then our ISHA legislative updates and action alerts. And later on, we'll show you how to subscribe to those legislative updates. They're really important for us to stay involved and stay informed. 34 cents of that dollar, or 34%, would go to professional practices in education. So things like continuing education, which is a large benefit for our members, as well as our ISHA convention, educational programs, and our special interest groups. And fortunately with ISHA, we do keep our governance and general administration low, where 11% or 11 cents out of that dollar goes towards our board governments, but really predominantly our office administration. Next slide.
I'm going to talk about the importance of diversity, equity, and inclusion in audiology, and what we can do to promote DEI in our clinical practice. I really like this year's World Hearing Day theme of hearing care for all, and it's depicted here in that picture. Our world is diverse, and there is diversity even in our relatively rural state of Iowa. And so with this diversity, we need to be mindful of how we can provide equitable services to our patients, clients, and the families we see, while being inclusive and accessible. Next slide, please. So why DEI in audiology? Well, because we have a culturally and linguistically diverse patient population. We see people of different backgrounds with different values, and people who may speak different languages. Those variety of people come into our clinics and in the schools that we might be serving. We also see patients of all ages, from babies to older adults, who have very different needs. Our patients have a diverse range of hearing losses as well, and capabilities are also variable among patients that we see. And also the patients that we see have different incomes and financial statuses. So we need to be cognizant of how we provide services for each of these individuals and seek out resources to provide individualized and high quality care. Here is some data about the diversity in Iowa as it relates to languages spoken, race, and poverty levels. And so, although English is the most common language spoken in Iowa, there are many individuals who speak other languages. Spanish is the second most common, and in other communities, such as the Amana colonies or in Amish communities, German is the primary language that is spoken. And indigenous language of Native Americans is spoken in the Meskwaki area. So depending on where you live and practice, you may see a higher number of people who speak languages other than English. And while the majority of babies born in the state are white, there are trends in the last 5 years where the number of white babies born has decreased and the number of Black and Hispanic babies born has increased. So that might just be a sign of what's to come, and we might see more diverse populations in race and ethnicity in our clinic settings. And the number of people with Medicaid insurance is growing, which suggests the number of individuals living in poverty is also growing. So knowing this information about our state's population helps us understand the need for diverse and equitable and inclusive services to ensure that these individuals have access to our services. Okay, next slide, please. So we know that about 1 in 1,000 babies born have a permanent hearing loss. Factors related to this prevalence may be complications in utero or at birth, such as maternal infections or prematurity. Other factors may be related to the mother's age, delayed or lack of prenatal care, use of tobacco during pregnancy, or socioeconomic status. And our state's EDDI program has been collecting data over time and has found that Black babies have greater loss to follow-up and are more likely to have delayed diagnosis of hearing loss. Next slide, please. And for school-age children, 1 in 100 have some degree of hearing loss. It may be permanent, it may be temporary, it may be congenital, it may be acquired, but otitis media plays a role in this prevalence of hearing loss in this age group. And depending on race and living conditions, some children will have an increased risk for otitis media and hearing loss associated with that condition. Next slide, please. And then even in our adult population, there are some differences in prevalence of hearing loss among different genders, races, and ethnicities. Older adults tend to have more hearing loss than younger adults. Men tend to have more hearing loss than women, and there's a variety of factors that might be surrounding that. And one is an intrinsic factor of hormones, and estrogen is thought to be otoprotective. And then more white people than Black people have hearing loss. And that might be related to melanin, which is related to skin color, runs through the cochlea, and that may be otoprotective. And more Hispanics and Latinos than whites have hearing loss. So there are intrinsic factors that are innate, and we can't change those. That may be a factor related to prevalence of hearing loss in all ages. And there are also extrinsic factors, connections to socioeconomic status, income, access to healthcare, health conditions, types of occupations, loud sound exposure. So for adults and children with these extrinsic factors that may play a role in risk for hearing loss, many times BIPOC are more at risk. Next slide, please. So what can we do to promote diversity, equity, inclusion, and access to our services? Thinking of the diverse cultures that we see, increasing our cultural responsiveness is one way to promote DEI and learning about more cultures, learning about different cultures, learning new perspectives will just broaden our already the patient and family-centered care that we provide. It goes beyond that, and it's taking into account and learning and respecting those differences in the individuals that we see. And then representation is also really important. So having materials that represent a variety of ages and gender identities, races, and abilities. So including pictures of BIPOC, LGBTQIA, children and adults of any ages, and individuals with disabilities. So there's evidence that individuals who feel represented and see others like them are more likely to see the potential for themselves and not feel so alone. For the diverse languages that we see, it's not enough to have family members be translators or interpreters when we provide our services. We need to seek out licensed interpreters for patients who speak different languages in order to provide thorough and quality care. CIRICOM is an option, and that offers phone and video interpretation of nearly every language. And Deaf Services Unlimited, which is right here in Iowa, offers ASL interpreter services. Health literacy is another way that we can promote DEI for individuals who speak languages other than English, which a lot of our written materials are written in, and also for individuals who might have a low reading ability. So ensuring that all of our written materials are easy to read and not higher than a 4th grade level. We can use the Flesch reading scale and the Flesch Kincaid grade level scale through Microsoft Office tools to help us modify our current materials if we haven't already done so that it improves the health literacy of and reading easeability for individuals. And then using more pictures than words can also be helpful, and using videos to show how to maybe clean your hearing aid or work through troubleshooting strategies with your cochlear implant. Those videos and pictures might be more helpful than reading the words for a lot of people who might speak a different language than English and or have a lower reading ability. And then for individuals with low socioeconomic status, we could consider alternate schedule options, thinking about work constraints, or maybe a family doesn't have access to a reliable vehicle. So we can offer remote care. And through our pandemic and the telehealth that we've been able to provide, that has shown to be quite effective over the last year. But we can open that up to more populations as needed. We can coordinate with other appointments that the patient might have if they're seeking other medical care at a clinic near you. Maybe coordinate that date and time so that it saves trips for that family. Offer alternate times, or maybe offer drop off and pick up services at their place of work or at their home. If they're wearing devices that need repairs or checks. Working with the educational audiologists for children can really be beneficial in coordinating care for some of the children whose families have a difficult time getting into the clinic. And then other resources to increase access include knowledge about funding options, maybe service organizations or grants that might be available to patients and families to be able to have funding for the services or devices that might be recommended for that individual. Connect the family with the social worker for support, where you and the family might discover other options for funding. That social worker can also help the family completing forms and maybe offer transportation assistance. And take extra time to educate the patients and families who need it. And I'm sure you are all doing that already. And then providing written materials to supplement the information that you're discussing, and written materials that have an easy reading ability. Okay, next slide. So thinking about the diverse, diversity in many areas, and including ages and genders and races, how do we need to individualize the treatment options that we provide to these families and patients that we see? So, thinking of different color options for the hearing aids that we might fit, or cochlear implants that we might fit. Thinking of what devices are most appropriate. Maybe if someone has a dexterity concern, a certain style or a certain device might be more appropriate for them than another device. Using sign language when it's appropriate, and then making referrals to other professionals when patients' needs are outside of our scope of practice, and then offering support groups for patients and families to connect with others and be able to share their experiences with others. And that too might be a way to increase representation of individuals that we see in our clinic. And then this list of other resources, they're new to me, and I just thought I would share them with you too. But this website, Listen with Lindsay, Lindsay is a pediatric audiologist, and she has this website where she shares information in an easy to read format, and she welcomes questions and collaborations from parents, family members, and other professionals. And it's a really inclusive community that she has through her website and newsletters that she shares. And then other resources for learning ASL or connecting with other races or other individuals or other communities that allows us to expand our knowledge about diverse populations we serve, and also provides resources for our patients who are interested in that representation. And Kevin is going to take it from here with additional resources on how we can promote DEI in our practice.
Thank you, Stephanie. So promoting DEI, and really, as we've gotten and hinted at and really just said, we really need to focus on representation for our patients. Patients really need to see individuals that look like them, talk like them, act like them, hear like them. And so we decided to show a few different examples of different books and literature out there. So now here, this is a book really great for preteens and teens about a girl named Harper who gets cochlear implants. Mila gets her super ears, cochlear implants, hearing aids, sound adventure, really gets about sound. So there's providing resources for these kids in an inclusive way. They can go in and point to the book and say, that kid looks like me. Historically, a lot of times when we think about representation, we think of animals. We have our phonak lion or koala for cochlear implants, but that's not really them. The kids see a cute animal, but they need to see themselves. And so really encouraging literature, self-advocacy, and reading more about them can really help them understand who they are in a part of their identity if they choose to have hearing loss as part of their identity. And we'll go to the next slide. When it comes to health literacy for patients, a graduate student from the University of Iowa, Erin Kaufman, she created this Access Audiology website. And basically this website has information that is very accessible and easy to use, and accessible, of course, if you have internet, where it has information for patients, for parents, for professionals even, which includes things like parent education materials that can really help patients know, okay, I have this rechargeable hearing aid and this is how it goes in. And you can really click on these smart forms that really, can really be used to help counsel patients, especially those who might be a little bit more confused or may have things like memory loss, or kids who might need a little bit more help with taking ownership of their device. So this is a really great resource in an accessible way at accessaudiology.com. Move to the next slide, please. And I wanted to switch over a little bit, and not only is being involved and represented, we want you all to be involved as well with ISHA. So one way we really appreciate is if you contact board members with any concerns. We're always happy to listen. So that's via email, is a great way, or through our website or ISHA at isha.org, especially on any issues you face as an audiologist, legislation concerns, and more. I see one of you on the call messaged me about an issue happening legislatively in another state, and informing our lobbyists, hey, this is something that we may need to look out for in future legislative sessions, is really important. So reaching out to us on those concerns, so that way we can best help you and work together as a unified profession. Of course, attending convention, there's CEUs involved, but really there's that sense of community. The numbers of audiologists in Iowa is pretty small, and we get to see each other or work with or communicate with each other pretty often. But at convention, we can learn with each other and learn from each other. And it's a really great way for us to unite and share our passion and love for this field. And of course, we should be doing a hybrid approach this year. That's something that's very important for me as someone in private practice, ensuring that that ISHA members who may not be able to take off work will have access to information. So that's something we're working on. Consider applying for committees or applying for future board positions. That's just a way to further your involvement. And the more you get involved, the more you learn about what we truly do as an organization. And of course, we want you to encourage others to be involved with ASHA, because audiologists, we can really unite for a change. It helps having one unified body for us to be able to engage in legislative advocacy. And the more hands we have together, the better we can be as a profession together. And one way we can do this is through legislative advocacy. So like we've mentioned, we've had an annual advocacy day at the Capitol. This year had to be virtual, but hopefully next year, things should become more normal and we can host that in person. I know I went to that as a student, and that was something that really inspired me to continue legislative work, reach out to my legislators frequently, and become more involved. So we encourage you to bring your students if you have them, patients if they're really fired up and want to get involved, and really just staying involved with that legislative process, because sometimes things try to get snuck up, or legislative bills try to get snuck in, and we really need to be all engaged together. And of course, continuing and participating in town halls. Next slide, please. Ways to stay connected. That link right there, or on our website, you can see register for our legislative updates. These are written by our lobbyists and really help. It helps me just keep a good track of, this is the things we're monitoring. This is the place, oh, it moved from the first funnel to the second funnel. And here's how we're pushing forward and what we're doing and staying involved. So it's a really easy to access resource for our members. Like I said, attend convention, receiving alerts through our Facebook page and email. Kellsie Busho has been really doing a phenomenal job in this role to create resources, and we have a lot of things in the work planned for each month, like Better Hearing and Speech Month, etc., that we're looking forward to releasing. We have the ISHA Connection. We have 4 issues of that, which is released quarterly. That's our electronic newsletter. Of course, if you ever want to see anything in those ISHA connections, we're always happy for feedback on that. And that helps you keep up to date on programs, services, and get to know us a little bit better. Lastly, we have some ISHA savings and discounts through our ISHA partners. So you can visit our ISHA partners page for those details. And next slide. And I wanted to keep my session short, because really we want to hear from all of you. We want to know, what type of programming are you interested? What are your concerns for audiology? What are things that you would want to see for town halls in the future, or more? So we'll open it up to all of you.
just had an idea about the ISHA connection. Because we do get email questions from different members throughout the timing between one issue of the connection and the next issue of the connection, I just was thinking that might be a good section to include in the ISHA connection, is because a lot of those questions could be, the answers to those questions could be helpful to others, and also putting it out there to more people, we might get other answers and more detailed answers from others too. So yeah, I'm just putting that out there, so because I'll forget after we hang up from this meeting. Yeah.
And it looks like Stuart's hand is raised. So Stuart, welcome you.
Hi there. Thank you for doing this tonight. First of all, I appreciate all of you board members that are taking your time to do this. Out of all the things I've done professionally, my involvement on the ISHA board was probably the most rewarding. As far as the dues, the fact that you have been able to keep the administrative costs to 13% is admirable. Unfortunately, as organizations move forward in the future, the ability to have lots of volunteers do things is certainly less than it was back when I was president of ISHA. So kudos to you for keeping it where you keep it. As far as my personal involvement or what I get out of ISHA, out of all the professional organizations I belong to, I get my biggest bang for my buck from ISHA. I rarely am upset with ISHA, whereas all the other groups that I belong to, I'm usually upset about something. So kudos to that. One concern I have is not so much ISHA related, but I was on a conference call or Zoom with the LEN program earlier, or end of last week. And one of the things we talked about is the Zoom CEU overdrive that everybody's been in through the pandemic. So there's concerns that I have that, yes, convention and CEUs is important, but at the same time, how can we foster the community without having necessarily the CEU overdrive or I'm tired of CEUs. I don't need any more CEUs. So that's a concern I have, and I'm not sure that I have an answer to that, but it's certainly something that I think we need to be aware of as professionals, that people don't need to come to ISHA for CEUs, at this point. So something to think about.
That's definitely a good point. I know I've spent a lot of times on Zoom calls with a lot of people, and Zooms can be very exhausting. So also thank you so much for all of you for attending another Zoom call. And so maybe perhaps that's a good opportunity for us not to do a learning session, but to have a happy hour through Zoom and just chat, get to know each other, and get to know our audiology colleagues across the state even better, or meet someone new, who knows?
Mm-hmm.
And Stuart, is your hand still meant to be raised on this?
Mm-hmm.
Nope. Okay, great.
An interest that we have is how to increase audiology membership and audiology involvement in ISHA. Those of you here, you're kind of our regulars, and how can we broaden this and make it bigger, I guess, from an audiology standpoint? Do you have any ideas?
How many audiologists are members currently? I haven't looked.
I don't know. Natalie, are you there?
I am, and I'm going to look it up real quick. If you'll just give me a minute, I'll switch
you.
screens here because that number is not coming to me off the top of my head. So.
I know one issue that we're having as ISHAs, we have a lot of people becoming lifelong members in general, and becoming, of course, a little bit more seasoned, as some people like to say, but not so many people new coming in and new members being engaged, even though we have people graduating. So one thing that I'm an early career professional, and so one thing I would like to see is involving more young early career professionals, but also finding those who've maybe been more involved. You have a lot more going on. You're as you transition from early career professional beyond, really coming back and staying with the organization and finding value when everyone lives a busy life and everyone has kids, or people have kids and families and lives outside of work. And so trying to keep programming effective and keep members engaged and recruit new members is something we're definitely interested in. If you know anyone, because ultimately it's about building our audiology community.
Yeah, maybe we could develop some specific programming specifically to young professionals, or just right out of school. Like, these are resources that you might need, that you could need, that is here for you. Somebody put together something like that, or for those that are staying in state and or maybe not, or just coming from Iowa. That might be helpful to them.
That's a great idea.
Really good idea.
I don't even know what platform they're on, but maybe they're on TikTok or something like that.
So it looks like we have 42 audiologists, and Diana, we do have a Facebook page. Kellsie Busho does a great job and has scheduled a lot of educational programming. We're trying to develop a lot more infographics that can easily be shared, so you can share it with your practices or share them with your friends to educate on the importance of audiology and other topics, including speech pathology related things. But we're all audiologists here, so.
Well, and I think probably branching out to Instagram would be a good idea, because I think that Instagram and TikTok and Snapchat are places where younger people are going. As my kids tell me, Facebook is for old people, Mom. And so, yeah, if we want to increase that younger population, that might be a place to go, or other places to go. Good ideas, yeah.
Yeah, I had no idea we had a Facebook group.
Okay.
I linked that in the chat.
Yeah, so we need to maybe we'll put that in our next ISHA connection. Like us on Facebook, and yeah.
This is Stu.
Mhm.
This is Stu again. One approach to early career professionals might be to put together some podcasts interviewing them and some of the challenges that they have. I know in my role with ASHA's Healthcare Economics Committee, I get emails fairly regularly from young professionals that are facing a variety of issues as it relates to, how am I supposed to do my job? I'm being told to do this, but I don't think that's right when it comes to billing and coding.
Mm.
Having some of the young professionals do a podcast with pairing a young professional with an older professional, or offering some kind of mentoring program through ISHA might be helpful. It's an old idea that still has merit, I think. anyway, as I'm thinking about it. And then the other thing, with the Instagram, if you have a podcast, you can target your Instagram message if we can get enough Instagram followers, but you can target your message to direct them to the podcast or direct them to the website, using multiple medias to get to where the content is.
Sure. And I also really like what you said about mentoring. I know Stephanie was one of my mentors when I was in grad school, and then I've also had a few mentors in ISHA who've been really integral to me wanting to stay involved and be involved, so that I 100% see the value for mentoring. And I think having a podcast would be interesting. Can we collaborate potentially with other states or nearby states and try to promote podcasts or get experts either in state or out of state? And I think there's a lot of potential there as well. So thank you.
Oh, and I want to give a shout out to Diana and Hanson and Emmy Getz for at the Iowa Ear Center for your posts that you put on Facebook that I see regularly. And it was funny, we were talking about what we were going to talk about tonight, and I had the DEI and representation, and then that same week, Emmy posted a video about different books that have representation and show. Oh, good, yeah, yeah, and yeah. So I just really think you guys are doing a great job with that in general, and I can learn from you too. So it's really great.
Yes, y'all have been doing a really good job. I've been keeping up with that too.
Mm-hmm.
And been taking a little inspiration over in Quad Cities to help promote patient education.
Yeah. I like spotlighting different patients. I think that's a great idea. And I'm sure the little kiddos and the families love that too.
Amy.
Hi, can you hear me?
Yep.
Hi.
Sorry, I just joined. I was in a class. How are you?
Good.
We're doing great.
Good.
We're just having a conversation about how to get more young people involved. Like
Oh.
you and Kevin are. Or just in general, like Kevin had mentioned, we have a lot of audiology members that are they have been
becoming lifelong members.
Lifelong members, yeah. And retired and whatnot. And so, and there's a lot of value to that group, but we want to keep ISHA going and long term. And so bringing in younger people would be beneficial. And so that was where we were at with the conversation, and we were just giving kudos to you and your Facebook posts related to the representation with the books and your little baby and her pink ear molds and hearing aids. So it's inspiring to us to think about how to spotlight those families too.
Thank you. That's very sweet of you to say. I have a lot of fun with it.
Yeah, I bet.
Also, Emmy, we were just talking about podcasts, and I feel like you might be a good person to collaborate with, just because I know you love sharing your voice. And Emmy went to grad school with me, for those who don't know, and she would always do videos of herself.
It's true. This is not a new thing for me. Yeah, I'd definitely be interested. Sounds like fun.
Great.
What else are you wanting in terms of programming, or any ideas for moving forward?
For you as a current member, even, what would you like? How can ISHA help you? If there is ever anything you want added to the ISHA connection, or you have an idea of something to write, just let us know. We can always include that.
No, I'm unmuted. So Barb, you had mentioned that you didn't know we had a Facebook. How do you typically get your information from ISHA? What do you read the emails, the ISHA connections, or how do you hear about this?
I think I read the emails, and I do get the ISHA connection, and kind of try and keep up on that stuff. But yeah, I'm old, so I use Facebook. It's a source of a lot of hours in my life. But I didn't know we had one, and I just liked us. So I will be looking at that from now on, because it's a place that I do get information from. So I'm happy to know that.
Wonderful. Does anyone else get information elsewhere about ISHA? Just thinking about where we're spending our time and efforts, if we can expand that or focus somewhere.
I have to say I rely on the emails.
Good. We'll keep those going.
In terms of frequency of emails, do you feel like we've communicated a lot with you, because we don't want to over inundate you with emails up galore?
I think the emails seem appropriate. Granted, I was on the board for a while, and I remember getting quite a few emails when I was on the board. So the emails I get now, just as a member, is fine.
Kevin, if you don't mind, I might just ask two quick kind of more administrative questions.
Sure, of course.
So, yeah, as we're thinking about the legislative session, we're kind of getting close to the back end of the legislation, with our second funnel coming up next week. Hopefully we'll be on a little bit of the downhill slide. And I know there's two important issues that we're really focused on right now. The primary one being our interstate licensure compact. And then we continue to have some conversations, or we're continuing to work on the lead K bill. One of the things that as a relatively new administrator for ISHA, I'm trying to kind of navigate, and then with our new lobbyists that we have, we often find ourselves working with a legislator that we're not quite sure if we have someone in that person's district. So it sounds like we have a couple of former board members who've probably dealt with some legislative issues in the past. And I'll maybe just give an example. 2 weeks ago, when a subcommittee meeting came up on the lead K bill, Stephanie graciously worked with one of her colleagues, Beth Walker, and we were able to get her as a speaker in that subcommittee meeting. So just curious from this group, you know, if you want to just maybe put a note in the chat or raise your hand if you've had an opportunity to visit with your legislator on either lead K or the interstate licensure compact, or maybe some issues in the past if you worked with your legislator on legislative issues. So that's one of the things I think we need to continue to work on and develop, making sure we have a lot of those brass tops, board members, former board members, folks who are comfortable reaching out, whether it's an issue on licensure, whether it's an issue on lead K or another audiology issue, those sorts of things.
You know, one thing that we did when I was on the board is that I think there were at least a couple times that we drafted emails, because sometimes I think, you know, when you're crunched for time, that it's easy to send an email, especially if it's pre-drafted, and all you have to do is fill in the blanks and figure out, okay, this is my legislator, this is who I need to contact. So I know we did that on a couple of issues when I was on the board, and I think, Kevin, you actually helped me draft a couple of those emails.
Yes.
Yeah, so I would just say if there's anyone that has a good relationship with their legislator or would ever be willing to help with that, and that's a great example as well, that a lot of times when we put out an action alert, we hope to be able to provide that type of kind of quick access or quick opportunity for our full membership to be able to engage. And then one other item I'll just throw out, and maybe I don't want to steal anyone's thunder, or Kevin, if you were already going to ask this, but I know we have a board meeting coming up later this week, and we're still working to fill the slate of speakers for the audiology sessions at the convention. So if you have any suggestions or topics or a great speaker that you want to hear from, that you are interested in, would welcome any suggestions or feedback on that. I know we put out a survey closer to the end of last year when we were wrapping up the 2020 survey, but sometimes interest can change, and if you think of something, would still welcome any input on speakers or topics.
And if you can't think of anyone now, just shoot an email to one of us when you think of it. Sometimes there might be a situation that comes up in clinic and you think, oh yeah, this would be a good topic. So yeah, share it anytime. I will just kind of fill some space here, I guess. I'm on the ISHA, we're called Committee of Ambassadors, and today was this Capitol Hill Day, and I met with Senator Charles Grassley. He actually was in the call at the time, which was pretty cool, and his assistant was also there, and then met with Joni Ernst's assistant and Marinette Miller Meek's assistant. And what we were advocating for is the Medicare access to services for audiologists, so that it will eliminate the physician referral for evaluations. It will change our kind of title from supplier to practitioner, so that it opens up telehealth capabilities. And then also to just broaden the service coverage for Medicare. So kind of expanding just beyond the evaluations and looking at additional evaluation services as well as treatment services. We also were advocating for just continuing the telehealth coverage for services and including more codes. So we were fortunate with the pandemic that we had telehealth kind of an emergency, on an emergency basis. We were able to provide telehealth care, and we're looking to expand that. And all of the assistants and legislators that we spoke to, they were all open-minded and felt like it was a really, it's been beneficial for many reasons, and it doesn't make sense to go backwards. And so it really looks like that one is going to move forward. And then also looking for extra funding for IDEA. So a lot of our kiddos can have more funding for the individualized services that they need. So we'll see where that goes. Where the difference in funding, that where it's at and where we want it to go is pretty big difference, but But we're hopeful at least it can increase and keep increasing year by year. So eventually we are at a point that is equitable for all of those kids. So yeah, it was a pretty exciting day and an interesting day. And I learned a lot about that process too. And it really, I just feel like it's where we can make a difference. So yeah, I'm thankful for our lobbyists with ISHA that are doing what they can for us in our state as well.
An interesting thing that has been opened up with Zoom is the willingness for legislators to meet up on a quick 10-minute Zoom call. And so I don't have to leave work. I could just, over a lunch hour or between patients, schedule a time for 10-15 minutes to say, these are issues affecting patients. These are their stories and what they're going through. And so I don't have to drive to Des Moines. I could just do that from the comfort of my own office. So it's really interesting seeing how we can engage through these e-meetings, or even I've had some phone calls, which I feel like previously they may not have been as receptive for. So it's really cool seeing that. So I encourage all of you, if you haven't yet, it's pretty easy to set up a Zoom call by reaching out to their office aides or staff.
Yeah, well, and it looks like we're at 7:31. We can be respectful of your time here too. If you had anything else to add, please go ahead and share. We can stay on longer if you'd like. Otherwise, always reach out by email, like us on Facebook, and if we get other social media access, we will share that. We will put that in our newsletter and in our emails out to you and others, and tell your friends to join. So thanks for being here and sharing your ideas too.
Yeah, thanks to you guys for putting this on.
Mm-hmm.
And thanks for bearing with my puppies the entire time.
That's been a fun thing about Zoom too. You get to meet children and pets and spouses or partners, and so it's pretty fun.
Yeah, my little Mako, he's deaf and blind, so he's
Can you
pretty
show him,
loud.
Kevin? I want to see. Hi, buddy.
an Australian Shepherd, and he's a little menace.
Oh, here's one of my puppies.
Oh, Woodford.
He looks so cute, and him and Cora look like little best friends already.
Yep, there's Cora.
So sweet.
They get along. Great.
Cora's really started mothering him.
Okay, well, we probably should head, I guess, you have other things to do, and thank you all again for being here, and we'll see you next time.